Welcome back. Thom Hartmann here with you. And on the line with us, Dr. Merrill Matthews, a resident scholar at the Institute for Policy Innovation, a conservative think tank. He's a contributor to Forbes.com, vice chairman of the Texas Advisory Committee of the U.S. Commission on Civil Rights, the website ipi.org. You can tweet him at Merrill, M-E-R-R-I-L-L, Matthews, M-A-T-T-H-E-W-S. Dr. Matthews, welcome to the program.
Well, thank you for having me, Thom.
You wrote a piece here, I'm not sure if this was just a press release or if this was published, but someplace other than the Institute for Policy Innovation. But it's titled, "Now We Know What the Republican Obamacare Replacement Plan Will Look Like." To start out, can you give us a quick summary of what you think now that Tom Price is probably going to be, Congressman Tom Price, who's very hostile toward the current versions of Obamacare, Medicare, Medicaid, what our healthcare system will look like if he has his way as head of HHS?
Yes, that piece appeared in Forbes and is available at Forbes.com.
Okay, thank you.
Tom Price has proposed legislation. He did the first edition in 2013. He did a updated version last year in which he outlines what he thinks healthcare reform should look like, and it's in actual legislative language. House Speaker Paul Ryan released earlier this year what he called a better way for healthcare reform, where he provides an outline of what he thinks should be, or essentially what the House's position is going to be on the Republican replace provision. It's not in legislative language that I'm aware of, but the two are very similar.
Okay, so if we could just summarize them real quickly, because if you could summarize them real quickly, because I'd like to have a conversation with you about them, and we've only got about 5 or 6 minutes here.
Right. What they do is they provide what's called a refundable tax credit. That essentially works like a subsidy for people to be able to buy health insurance. It's targeted at people who do not have access to employer-provided coverage or Medicare, Medicaid, or the VA. So essentially, if you're buying your own insurance, you would have access to this subsidy.
What's refundable about a tax credit? You mean that you pay it back to the government?
No. It's a refundable tax credit.
What does refundable mean?
Refundable means you can use it even if you don't. Even a tax credit applies directly against what you owe in taxes. So if they provide a $3,000 refundable tax credit, and let's say you owe $1,000 in income tax, you don't pay the $1,000 and you get a check for $2,000 in return.
Okay.
If you don't pay any taxes, you get a check for $3,000.
I understand. Okay, thank you.
So it does that. They both try to address what's called the guaranteed issue provision, and that's where insurance companies can't deny people. They essentially say if you stay continuously covered and you shift from plan to plan, there can be no imposition of a pre-existing condition exclusion. But if you're uninsured and then you get a medical condition, they can exclude the pre-existing condition for 18 months, or they will provide a state-based high-risk pools that you can move into to provide health insurance coverage.
So I get
35 states had those.
Right. So I have no insurance. I get a cancer diagnosis. I'm working at McDonald's. I'm making $13,000 a year. And what do I do now? I have a pre-existing condition, so nobody will insure me. So I apply to my state.
You go into the high-risk pool. 35 states had those prior to Obamacare.
How do you go into a high-risk pool?
Some didn't work as well.
Okay. All right. Well, okay. Let's move along. And then there was one other piece to it, as I recall.
There's those aspects of it. They want to allow health insurance across state lines. There's going to be malpractice reform. I think those are the key
that's pretty much it. Okay. So we've got that as opposed to, Medicare right now. What I love about Medicare, and I'm on it, is that I can walk into any doctor or hospital. I've never had anybody turn me down. And just say, here's the number, here's the card. I never see any paperwork. I never see anything. And it's just, it's marvelous. I lived in Germany for a year. They have, at that time, this was in the 80s, they had single-payer health insurance. It's slightly modified now. And it was the same deal. Healthcare was considered a right, not a privilege. I'm curious, do you think that we should do away with our publicly owned fire departments?
No, I don't.
if you think that we all collectively should pay taxes for the extremely unlikely event that any of our houses might burn down, why don't you think that we should all pay taxes for the far more likely event that we're going to get sick?
Well, let's go with your analogy. We pay taxes for the fire department, but we also buy private insurance to protect our homes and to reimburse us if we lose our homes. That's something where we go out and pay for it ourselves, and the federal government isn't involved in that at all. And what we're talking about here is insurance. You can do a single-payer system. Canada has one. They have some benefits and they have some problems. What we've been talking about here, there's no will among Congress to do a single payer system. Medicare has some benefits, but it also has a number of problems, including the fact that it's facing a financial cliff here very soon. And you're right, Medicare works fairly well for most seniors, but that's in part because it's actually a fairly small part, not fairly small, but it's you do that because you've got the private sector that's out there subsidizing Medicare.
No, it's the other way around. The Medicare is subsidizing the private sector. I mean, the reason that Stephen J. Hemsley has taken over $1.6 billion in compensation as CEO of United Healthcare is in large part because of Medicare Advantage plans. I mean, you know, the conservatives drilled these holes in Medicare back in the 80s and 90s so that these for-profit health insurance company, I think United Healthcare started offering these Medicare Advantage programs in, what, 86, wasn't it, during the Reagan administration? Specifically,
they started, it was a while back, yes.
Yeah, specifically so that somebody could make a buck off it. Here's what I don't understand, is if you think that fire department, and with regard to your analogy about, yes, you buy insurance for your possessions, if you want to extend that analogy, then I would say, okay, if I get sick, I might lose my job, so I might want to have unemployment insurance, or I might, but if my body is on fire, I want that fire put out, whether it's literal fire or whether it's cancer or heart disease. Just like if my house is on fire, I want that house put out. I want that fire put out. And it seems to me like that should be a public service, a public duty. And it is in every other developed country in the world except the United States. Can you name for me any developed country that uses a system like what you are proposing successfully?
Do you consider South Africa a developed country?
No.
Okay. Well, South Africa has a private health insurance system, as does Singapore.
Singapore is a dictatorship, and South Africa, I mean, when South Africa rewrote their constitution, several American companies literally went over, to quote, help out, and wrote into their constitution that corporations have rights of personhood. It took our Supreme Court to decide that, but I mean, no, I don't. So those examples, in my mind, don't fly. I mean, I've been to Singapore.
With your analogy of somebody catching on fire, which I assume means somebody has a major accident or illness and they need care, we do have it is a statutory right under a law called EMTALA. If you go to an emergency room, they have to treat.
I know that was passed during the Reagan administration, but if you go into the emergency room and say, "Hey, I've got this lump in my breast," or "I've got this pain in my my upper left side that kind of feels like a lump on my pancreas," they'll say, "You're not bleeding. Get out of here." And yet you could be dead, I mean, or they'll say, wait until that cancer grows to the point where it breaks through your breast, or wait until that pancreas starts, until you start bleeding out through your bowels.
That's just not the case. Every major city has a publicly funded hospital there, which is there to provide care for people who are uninsured and have no income.
And you're saying that this is the Republican/conservative optimal health care outcome.
I would not call it a great system, but they're there to do that. So there is a safety net there, and what you want to do.
What I don't understand, please, maybe you can enlighten me here, Dr. Matthews. We're talking with Dr. Merrill Matthews of IPI. Here's what I just don't get. What I was running businesses back in the 70s in Michigan when Michigan law required both health insurance companies and hospitals to be not-for-profits. And we provided Blue Cross Blue Shield to all of our employees. This was in 1973. We provided it to all of our employees. It cost about $35 per person per month. The hospitals, Ingham Medical, St. Lawrence, Ingham, and there was a third one, Sparrow Hospital. They were all not-for-profit. and it was relatively inexpensive. Again, during the Reagan administration, virtually right across the country, those laws changed so that hospitals could become for-profit, health insurance companies could become for-profit, and suddenly now we have literally billionaires who have made billions off of health, basically ripping us all off. How is it that introducing the profit motive into something that really should be, in my opinion, a part of the commons, if right to life, liberty, and the pursuit of happiness doesn't include not dying from a disease, I don't know what does. Why on God's green earth would we want to incorporate into our healthcare system, other than they kick money back to right-wing think tanks and Republican candidates for political office? Why in God's name do we want to be throwing profits at stockholders and CEOs?
Well, if those hospitals are kicking money back to right-wing think tanks, I wish you'd point them out to me because I'd like to find them. And let me just point out,
they have lobbyists. I guarantee, right here in Washington, D.C., right around the corner from me on K Street. I think it's called the American Hospital Association. They pass out a lot of money in this town.
They may pass out a lot of money to town, but I'm not aware that they pass out a lot of money to right-wing think tanks.
All right. Well, present company accepted. Let me say that. But
let me just point out something I've pointed out to people time and again. I'm not here to defend all the companies, the insurance companies, and the hospitals moving from nonprofit to for-profit. What I have pointed out, though, is I have never been able to find if you compare the for-profit hospitals and insurance companies and the not-for-profit hospitals and insurance companies, I've never been able to find that the for-profit necessarily costs more than the not-for-profit. I've never been able to find
in the modern era
not-profit that's cheaper than the for-profit hospital.
Yeah, well, I don't totally disagree with you in the modern era because so many of our nonprofits are now being run as if they were for-profits, and they just their fund balance and all that. But anyhow, it's been an interesting conversation, and Singapore and South Africa, I'm not sure I want to imitate, just frankly. But Dr. Merrill Matthews, resident scholar at the Institute for Policy Innovation, IPI.org is the website. You can tweet him at Merrill with 2 L's, Matthews with 2 T's. Thank you, sir.
Thank you.
This is the Thom Hartmann Program.